Mark, thank you so much for being here, and I'll turn it over to you.
All right, thanks, Rich. Let me take control of the screen here. Can you see the presentation, Rich?
Yes, I can.
Okay, great. First time I've presented on Teams, so new experiences for all of us. Thanks everyone for being here and listening in for the next 30 minutes. So I can tell a cautionary tale and a success story all rolled up into one about the Joint Information System and the Joint Information Center during COVID. And you're looking at the Joint Information Center as it stands right now. It's a desk in the corner of my bedroom since we've been home since March, but at least the view is nice into my backyard. I'd like to start out by just telling you how things usually work, or how they're supposed to work during most traditional disasters like floods and snowstorms and the like. The PIO essentially is informing the public of best practices during an emergency event in order to keep the public safe, or as safe as possible. We're supposed to be first, be right, be credible, show empathy, promote action, and show respect. And we've been doing that for several months now about COVID. The Joint Information System, when I talk about that, it's simply a network of PIOs, public information officers, working together to deliver accurate, coordinated information. And we've been doing that so the public at large can get a consistent message. And that's the most important thing we can do, and the most important thing that we have done through this whole process. All response organizations and partners need to be acting as one, because if you have information and guidance coming from the health department and slightly different guidance coming from emergency management, the public won't know what to believe. They'll lose faith in the state's ability to respond to the emergency, and so that's something that we avoid at all costs. And I think we were successful. We've been successful so far. I keep talking about this like it's over, and it's not by a long shot. So we're still in process. It follows the incident command system. Primary agency is the lead PIO. It was health at first, and then when we went to the SEOC activation, it came to the SEOC JIC. And the lead PIO just kind of coordinates things, doesn't necessarily prepare all the materials or drive messaging. And again, for background, Joint Information Center is a physical location where we usually have multiple PIOs gathered to work together on this. One-stop shopping for the media, and can be a location for media briefings. But like I said, the JIC is now in my bedroom, and none of those people are coming here, nor have they been here, thankfully. Okay, so when we started this this incident, I believe it was back in January, late January, there was talk of the virus, and so the Department of Health started its messaging efforts. They built an internal structure. They were getting all of the media inquiries. They were doing outreach, trying to get people ready for this. And VEM was in a support role, just like many other state agencies. We were helping them out by amplifying their messages on social media and any other way we could support them. And of course, questions for health ramped up over time as this thing inched closer and closer to the United States. Then on March 11th, we activated the SEOC to support the Health Operations Center. And so that's when the JIC was activated. We had people from VEM, state police, transportation, agriculture, health, and the input of many other state agencies. So our first problem unexpected occurrence, because none of us have ever dealt with something like this before. We found that in the past, when we've had a transportation event, it's been helpful to have a transportation person in the JIC. Same thing with other topics, and we really wanted a health representative in the JIC, someone who could liaise between the JIC and the Health Operations Center, and someone who was just a subject matter expert. But health needed all of their people at their Health Operations Center. I have to admit, I was a little skeptical at first, but then when I saw their call volume, I knew immediately after a day that that just wasn't going to work. So instead, we agreed to open a hotline between the JIC and the HAWC, so we could have instant contact and communicate quickly. But even that didn't work because the JIC and the HAWC both had immense call volume. It precluded the availability of a dedicated rep on either side to answer calls from the other. We had questions about the response coming in, and a lot of these were new, so it left little time for coordination. Questions from the press were coming into the JIC that should have been going to the HAWC, and vice versa, to be honest. The press didn't really know where to go for certain questions, so they were kind of fishing in the dark. So what we did was we established one email box for all COVID media inquiries for all state agencies, something we'd never done before. I have to tell you, it was a scary proposition for all of us, so we were all a little reluctant to do that, especially since we kind of lose control of what questions that would normally be asked of us would go to this central mailbox. But we set up a procedure for who would answer what and how that would be triaged. And then we had more problems, of course, because on day one, we had hundreds of media inquiries coming into CV19 Media. Once the press heard all of your questions can be asked at this one email address, of course, they all went to that email address. I thought it would be a good idea for me to watch the email box and still try to do my other duties. That didn't work because it was so overwhelming. And we had questions coming in from multiple questions coming from the same news organizations. And so timeliness of replies, that was certainly a problem. So what we did was we threw more people at it. I brought in 2 additional PIOs to the Health Operations Center to help with volume, and I brought in extra PIOs to the Joint Information Center. Most questions were health related, so we decided that the person who was triaging the questions would be stationed at the health department. And so if there was a question that person couldn't answer, then they would send it over to the JIC and we would take care of it. And we certainly chose the right person for the mailbox. This person was highly organized and categorized questions and marked complete when done. And one of the secrets to the JIC is recognizing people's strengths. And I certainly recognize that this was a strength of Stephanie Bracken, who really came in and brought order to the whole thing. And that helped immensely. So then we had to decide who answered what questions. We had a general idea, but there were a lot of new issues. Every state agency was involved. As the director said, AHS had a lot to do. The Agency of Education was dealing with, for the first time ever, closing of all Vermont schools. The economy was being impacted, so ACCD was dealing with that fallout. And VEM and the EOC, we were putting together temporary hospitals. We were trying to acquire PPE and providing support to towns. And since so much was going on, EOC agency reps were swamped and couldn't necessarily deal with media questions. And I have to tell you, over the 15 or so years that I've been doing this, I'm usually able to just walk across the room and say, okay, how many roads are closed? And I get that number and I can answer a media inquiry almost immediately. So having questions lingering out there, that was that created a little anxiety, but there was really nothing we could do about that. Everybody was just so busy and we were in uncharted territory. But fortunately, that was mitigated a little bit because we did know the state communicators. They didn't have all the answers either, but there is a team that meets regularly to discuss informing the public. We had contact information for most agency communicators, and so they could kind of back at their headquarters offices could navigate what they needed to do to get the answers. Again, it wasn't immediate. It took some time, but all were willing to take on the inquiries, and we really have a great team of communicators in the state. A lot of very dedicated professionals who are really good at what they do. And like I said, uncharted territory for everyone, so that complicated things. All Vermont schools closed. Homeless populations no longer were able to use traditional shelters without social distancing. That created space issues. Childcare was needed for thousands of essential workers. Businesses were shut down entirely. There was a temporary surge at hospitals, not to the degree to which we feared, fortunately. And federal health guidance was evolving just as you would expect during a pandemic that involves a virus that no one has ever seen before. So what did we do when we didn't have an answer? And this happened quite a little bit. I wouldn't say all the time. Credibility equals honesty, and we just had to say we don't have that yet. We're working on it. We explained the situation and why it was difficult, and that we understood that this was an issue that we needed to deal with and we were dealing with. And what we did to handle that, what we did give the press was we reiterated known guidance, washing hands, keeping your distance, staying home when you're sick, that sort of thing, until we could get specific answers to specific questions. And we stayed away from timelines. We asked the press what's a realistic time frame deadline you have, and then we tried to keep to it, but we didn't make any promises. But I think we did okay. What really helped was the Monday, Wednesday, Friday press conferences established by the governor's office after, I'd say, a week or so. They've since moved to Tuesday, Friday, but the governor gives his address, and then guest speakers, subject matter experts, and then commissioners and secretaries were either there and still are there, either in person or on the phone. The health commissioner, of course, is there every day, AHS secretary on most days. And early on, a lot of people had a lot of questions for the labor commissioner because so many people were out of work, and the rest of the, not every commissioner or secretary was on the phone, but many of them were, so we could knock out those answers. So the protective actions under the governor's executive order led to some unique questions, and the executive order itself didn't anticipate a lot of these questions because this is uncharted territory. We didn't know how things were going to work. This was all brand new. So we got questions like, can I cross state lines for child visitation? The answer is yes, you can do that. What if a county turns yellow when I'm there? We determined yes, well, you do not have to quarantine when you return to Vermont if it turns yellow when you're there. And my favorite question, does my private jet count as a personal vehicle when traveling to Vermont? Yes, it does. However, since you're coming from Florida, you still have to quarantine. So fly commercial, I don't know. We struggle to answer a lot of these because those who made the decisions and could kind of rule on the intricacies of these, they were extremely busy. I mean, if we were putting in 14-hour days, the secretaries, commissioners, directors were putting in 16 or 18-hour days, and we had to figure out a way to answer these without necessarily leaning on those people too much. So we compiled the questions and answers, and we kept a cheat sheet for the most common, and we created a main contact center for calls. That's always 211. They do a great job. Thank you very much, Mary Ellen and Sarah and staff. They reported up the chain to us what the public was asking and needed to know. Us meaning the JIC and the Health Operations Center. And of course, we had someone sitting right in front of Facebook and Twitter doing social media monitoring, so we could get right on top of any rumors that would arise. And now that I'm like 20 minutes into this, I should tell you I can only see my my presentation. So if you're raising your hand, I apologize. I can't see it. I'll have time for questions at the end if you do have any. So sorry about that. Next. We also created the big simplified guidance document. Well, the guidance document that is now on the ACCD website that outlines all the protective actions that we have. Most common questions were also led to clarifications in future executive orders and guidance. And sometimes we just couldn't answer. We didn't have an answer for people. We would just, okay, well, this is what the guidance says, and so we did the best we could on those. But there's not always an answer. That's especially in a situation like this. Now, mental health is big, and Sonny Provetto is going to do a presentation later today. Many of us were burned out in record time. First of all, by the time the JIC and the SCOC opened, the Health Operations Center had been open for a month. So, and they were burning the candle at both ends as far as media inquiries coming in and hours of the day. Someone joked about whether or not we can put in for overtime for all the times we dreamt about COVID and media while we slept. But we watched out for each other. We have a really good team. We had some disagreements, but I don't remember any fights among communicators or this is what my agency is going to do. No, this is what my agency is going to do. We really, we functioned really well as a team and continue to do so. Again, it's not over yet. I have to get that through my head. We had a safety officer in the SCOC, so if one of us started showing signs of really burning out, then that person would have sought help for us. And taking time off was difficult, especially since there are so many committed professionals who do not want to walk away from the incident. But it was an absolute necessity, and I should say early on, taking time off meant taking one day on the weekend off. Instead of working Saturday and Sunday, work Saturday or Sunday. But all that helped a little bit. But the situation we were in, everybody was pushing through this, and so did we, because it's been so massive. Then in March, we all went home. The SCOC, JIC, and HAWK closed operations, and we started working remotely. There were some hiccups, but happy to say technology has made operations almost seamless. I mean, just take this conference for an example. We don't get lunch and coffee or a room at Lake Maury Resort, but we're all here and we're able to take part in the conference. And so technology, thankfully, it is where it is, and we've been able to operate as a joint information center and SCOC and HAWK from our own homes without really noticing much of a difference. Well, eventually we found our cruise control. We got into a rhythm, and when I say cruise control, that means we were cruise control was still set at 150 miles an hour because it was still busy and still stressful and overwhelming. But once the system was in place, we could focus on promoting protective actions and more easily handle the questions that were coming in and where they would go and who was answering them and what our answers were. We created social media posts and coordinated them with state agencies to share them so we would have more eyes on them. Graphics were developed each week by the JIC and by ACCD and Health on what the newest protective actions meant and what they were. And we even had time to do a TV ad with the Vermont Association of Broadcasters with Rusty DeWeese and the VAB. They've been great partners in this. They offered the time and the production work, and so we were able to take care of that. Eventually, the media inquiries have slowed down somewhat, and they're somewhat predictable, especially, when school started, we started getting all the questions about schools reopening and the issues that could pop up, and we've been getting questions about testing for months, and it allowed us to do more planned marketing activities ahead of the mandated mask, ahead of the mask mandate. AHS, Health, and the JIC ran a campaign with all state agencies, Masks on Vermont. A lot of you asked for those posters and posted them around town, and we very much appreciate that. We gave further business and individual guidance, and someday we will have a COVID vaccination campaign that we will all work on, and it will be led by the health department, and we'll all support them. And like I said, media questions mostly are now focused on the most recent issues: school reopening, contact tracing, testing. The JIC staff technically is down to one, yours truly, but I can call up what I forgot to mention that when I was compiling the team, I was approached by our director and Director Borneman and Commissioner Sherling, and told that I could put together an all-star team of communicators, because this was so important. And that's, if someone wasn't selected, that doesn't mean they weren't an all-star, but I knew who had the most experience, and so they are ready to step things up if they have to. Health media inquiry staff is down to 2 people, but they still have to work through many channels. And one thing that's for sure is that it will step up again, and we'll be going a mile a minute. So with that, I'll hopefully go back to the team screen and see if there were any questions for the last 20 minutes or so. Are there any questions? Does anyone have any questions or anything that they would like to comment on with our response, or anything at all? Am I on? It would be just me, just talking for 30 minutes and not be on.
Mark, it's Rich. So
Yes.
a couple of things came up. Just someone was asking about the abbreviation. So we spelled out JIC is Joint Information Center.
Yes.
The GIS is Joint Information System. EOC is Emergency Operations Center. HOC is Health Operations Center. It's basically the command post for this event. And the SEOC is State EOC, State Emergency Operations Center. That was essentially what I got from the chat. So if there are questions, we have a little bit of time. We can go ahead one at a time, please. And I don't know how you're going to determine that, but go ahead and unmute and ask Mark questions about what this whole process has been like with COVID.
Todd Manise, thank you to all the frontline workers, all of you folks. Great job you've done.
Thank you. All right, I like this. That means my presentation was thorough, or everybody is out of the room getting a drink or sleeping.
All right, I'm not hearing anything. So, Mark, thank you so much. Great
thank you.
presentation, a lot of good information, and working in the SEOC for, well, since it opened back in whatever month it was. It's been so long, I can't remember. There were some things that I didn't even know was going on because I've been focused on the mission and resource support side. So, thank you very much.